Hello, and welcome to the 10th episode of the True Dollar web series. As you may know by now, this year, Texas Trust will be presenting monthly webinars on Facebook Live every second Tuesday of the month to help our community and members manage their finances better during the tough times we are living in. My name is Michelle Carter-Pope, and I am the Senior Business and Community Engagement Partner for Texas Trust, and I will be your moderator for today. Like always, you are welcome to engage with us by leaving comments or questions during the live session. We'll be sure to answer as many questions as we can in the allotted time and to get back with you individually. Okay, you may be looking to enroll in Medicare during open enrollment this year, or you may want to know how you can maximize your options so you can be prepared when it's time. Today, be discussing the key facts about Medicare, and he will be happy to answer any questions in the end. But first, we at Texas Trust would like to highlight some resources accessible to our communities. So every month, we will be highlighting a nonprofit organization located in one of our Texas Trust towns. Our October Spotlight nonprofit organization is Mansfield Mission Center. I would like to invite their executive director, Carmen McMillan, to share how they are an incredible resource for our community. Carmen will stay on until the end to take any questions our viewers may have. Carmen, over to you.
Thank you so much, Michelle. It's such a privilege to be with y'all today, and we so value what Texas Trust does in our community every day. It takes a village to be able to take care of folks, especially during these times. And so being invited to be part of this discussion specifically is so exciting. Our organization exists to see community members thrive. And when we talk about thriving, we talk about physical health, and then we talk about their financial well-being. And so this just really fits well with our vision. We provide financial coaching and financial resources for community members in need. And we have a free healthcare clinic. And so for those folks that might be watching today who Medicare hasn't kicked in yet, or you might have family members that don't have healthcare insurance, we provide a wide variety of services from primary care to mobile mammography on site at our clinic and to other physician referrals. And so thank you for the opportunity to share a little bit about that today. And so I just encourage anyone who's watching or listening today to please reach out to us if you or someone you know could benefit from these services.
Thank you so much, Carmen. So now a little bit about Texas Trust. Our mission is to build brighter financial futures. We've been helping people live brighter since 1936. We are a not-for-profit company. That means we invest profit back into the credit union to help our members and communities by offering higher savings rates, lower loan rates, and through community engagement. We are a full-service financial institution with 20 locations in Texas, and for more information, you can visit texastrustcu.org. Now I'd like to introduce our presenter for today, Mr. Tom Clark. Tom Clark has worked for 33 years in the Social Security Administration as a claims representative, operations supervisor, field representative, and public affairs specialist. He retired in June 2011, and he is now a self-employed Medicare and Social Security speaker and consultant. 6,000 speeches and talks while working for Social Security, more than anyone in the history of the Social Security Administration. Twice he was presented the Commissioner's Citation, Social Security's highest award. He received 4 Deputy Commissioner of Communication citations for excellence in making the complexities of Social Security and Medicare easily understandable. Many publications with a monthly readership of over 2 million persons published his columns about Social Security. He produced and appeared in over 200 TV shows about Social Security. He has been considered the expert in explaining how receiving a pension based on work not covered by Social Security, such as the teacher's retirement of Texas, can affect Social Security benefits. Many Social Security employees have told him they never understood the windfall elimination provision and government provision offset law until they heard his explanation. So Tom, we're excited to have you present today, and I will now turn it over to you.
All right, thank you, Michelle. And I appreciate that introduction, and the people listening. If you watched last month's show we did on Social Security, then welcome back. And I think you'll find that Medicare is going to be far more complicated than Social Security, and it's far more important to get it right. With Social Security, it's important to know a lot of things, but you can't mess it up too bad, because no matter what you do, you still got a guaranteed check coming in that goes up with inflation for the rest of your life. Maybe there's a strategy you could have used, would have had a higher check, but no matter what, you still got that guaranteed income for the rest of your life that keeps pace with inflation. With Medicare, if you don't have your Medicare in place properly, you have a serious illness, you could easily be bankrupt, and that's really not an exaggeration. You'd be amazed how many people I talk to that Medicare pays $1 to $2 million in hospital and doctor bills in 1 year for one person. So it's not really hard to do, but you need to make sure that you do it properly. Now, Medicare's age hasn't changed. We pretty much all know that Social Security's full retirement age is gradually going up to 67. But Medicare's age has not changed for anyone. It is still 65 for everyone. So we're still entitled to Medicare at age 65. Also, if somebody does get disability from Social Security, after 2 years of receiving those checks, they're entitled to Medicare. If somebody's allowed disability because of ALS, Lou Gehrig's disease, they get Medicare the first month they're eligible for a check. And the special Medicare program for people who have kidney failure, if somebody is undergoing dialysis or having a kidney transplant, they can get Medicare even if they're not drawing disability, even if they're still working, not drawing disability benefits. Most people, of course, do qualify at age 65. And it doesn't seem like I'm able to, there we go. We need to go back. I don't seem to be controlling it here. So we need to go back to one that says Part A, Part B, Part D. There we go. Okay, I'll just tell you when to change the screens, because it doesn't look like I'm able to control it. So the basic parts of Medicare Part A, which is the hospital insurance. Medicare Part D is physicians and outpatient insurance. And then Part D pays for prescription drugs. Let's go back to Part A, the hospital insurance. People say Part A is free, and it's really not free. It's just a matter of when we pay for it. A small part of the FICA tax we pay when we work pays for Part A. So we pay for Part A of Medicare while we're working. We then don't have to pay for that once we are retired. So if you qualify to receive a Social Security check based on your own work or your spouse's work, even if you're not drawing those Social Security benefits yet, Part A doesn't cost you anything because you or your spouse paid for it while you were working. But Part A just pays the hospital bill itself when we're in the hospital. So doctor bills and outpatient treatment, those are paid for by Part B of Medicare. Now, when I say Part B covers doctor bills, that means all doctor bills. So when you're in the hospital, then you get out, you get the hospital bill in the mail, that's covered under Part A. You get bills from all the doctors that treated you in the hospital. Since those are doctor bills, that is covered by Part B. So Part B covers all doctor bills in or out of the hospital and outpatient insurance. And Part B does have a cost. Part B does have a monthly premium. If we go to the next slide, which this year is $148 a month. They just hold that Part B premium out of your Social Security check each month once you're drawing Social Security checks. If you're not receiving Social Security yet, maybe because you're waiting until later to start your checks, then there's a variety of ways you can pay that premium. They'll let you know. Once you start drawing your checks, they'll hold it out of your check automatically. Now, since Part B has that cost, that premium, it is a free country. You do have the legal right to turn it down, but be very careful about that. Listen to the flip side of that coin. The flip side of that coin is it is a free country. You do have the legal right to bankrupt yourself. There is a situation we'll talk about when you don't want to take Part B. But once you are retired from where you have your health insurance, or if you're self-employed when you turn 65, or if you're working for an employer of less than 20 employees, once one of those situations applies, retirement, self-employed, working for an employer of less than 20 employees, you've got to have Part B in place because Part B is your primary payer at that point. There's a lot of reasons you want to have Part B in place. Once you are either retired for where you have your health insurance, you're self-employed at 65, or you're working for an employer of less than 20 employees at 65. Several reasons why you need Part B in place. And number one, $148 a month. It's got to be a great deal, right? Does anybody want to start an insurance company and insure people from like 65 to 100 whatever for doctor's bills for $148 a month? Well, of course not. That's only 1/4 the cost of the premium. The federal government pays the other 3/4. So every month somebody pays $148 for their Part B Medicare. For that same one person, for that same 1 month, the government pays $444 for their Part B. We pay 1/4, the government pays 3/4. Now, if somebody has income above $88,000 for an individual or $176,000 for a couple, they don't get the full 75% subsidy from the government on that premium. So they pay more than 1/4 the cost of Part B's premium. And those figures are above $88,000 for an individual or $176,000 for a couple. Now, the issue is they don't know how much money somebody's making this year or even last year. So they always have to base that higher premium on somebody's income 2 years ago. So here in 2021, that higher Part B premium is based on somebody's 2019 income. In 2022, it's based on their 2020 income, and so on. But if somebody's income has gone down in the last 2 years because they retired or became widowed, they can ask, they base that premium on their current income, not 2 years ago. So if you and your spouse have good jobs, you retire, you file for Medicare, and then you get a letter saying, based on your income 2 years ago, we have to charge you this higher premium. If your income's gone down because of retirement, then be sure and call Social Security up and let them know, because they don't know that's why your income went down unless you tell them. There are some other reasons that if your income goes down because of them, you can ask they base that higher premium on your current income, not 2 years ago. The other reasons don't apply as often as retirement or becoming widowed. But on the letter they send you saying you might owe that higher premium, they list all those reasons that you could use if your income goes down because of them to not have to pay that higher premium. Most people pay 1/4 the cost, $148 a month. Now, the second reason you want to make sure you have your Part B in place, once you are retired from where you have your health insurance, or you're self-employed, or you work for an employer at age 65 of less than 20 employees, the second reason you need Part B in place is because in any of those situations, Medicare is your primary payer. Medicare pays first. And once Medicare is your primary payer, nobody else will pay anything Medicare pays for. So if you don't take Part B of Medicare in that situation, you just made yourself Medicare, because you'll pay Medicare's 80% of those doctor bills out of your pocket at a minimum until you get your Part B back. And that can be a lot of money in a very short period of time. I got to this point in a talk I was doing a few years ago, and there was a gentleman who was going to be the next speaker after me. He was sitting beside me. It was a retirement seminar for an employer I was speaking at. This person was a retiree from that company. And he's going to get up after I talk and talk about what he did for companionship, what he did to keep busy in retirement. Well, I got to this point in my talk, and he raised his hand. He told me he was 70 years old. He was doing pretty good then, but the year before he had been very, very sick. He told me in that one calendar year, Medicare paid $1.3 million in hospital and doctor bills for him. 600,000 of that was doctor bills. Now he didn't, but if he had turned down Part B, that would have been his $600,000 bill to pay. And in case you think that's just like once in a whole lifetime occurrence, once in a whole country occurrence, you don't have to worry about that happening to you. That's not the case. People beat that number with me all the time. The record for me, for myself, was set one night in Plano. I was speaking at a seminar, I got to this point and the woman in the audience raised her hand and said, that's nothing. She said, last year, Medicare paid $2.1 million for my mother in hospital and doctor bills in 1 year. That was over $1 million in doctor bills. Her mother had Part B, but if she hadn't, that would have been her $1 million bill to pay. And the last reason you don't want to turn down Part B, once you're 65 and over and retired from where you have your health insurance, or you're self-employed, or you're working for an employer of less than 20 employees. The third reason you need Part B is because if somebody doesn't take Part B at that point, and Medicare is the primary payer, and then they realize later, uh-oh, I've made a huge mistake. So I'm going to run down to Social Security and get my Part B back. When they get down to Social Security, they've got some good news for them down there, but they also have some bad news. The good news is, yes, they can get Part B back if they didn't take it when they should have. But the bad news is they can't get it back today. If someone doesn't take Part B in that situation, when Medicare is your primary payer, to get it back, they have to wait till the first 3 months of a later year to even reapply for Part B. So every year from January 1st to March 31st is an open season, a chance for people who didn't take Part B when they should have to apply to get it back. If they apply for Part B in those first 3 months of the year, it won't start till July 1st. And that premium, that $148, will be 10% higher for the rest of their life for each year they didn't take Part B when it was the primary payer when they should have. So that's the reason when in that situation, retired from where you have your health insurance at 65, self-employed at 65, or working for an employer of less than 20 employees, in that situation, you've got to have Part B in place. Now, there's one and only one exception to that, and that is actually the next slide. If we go to the next slide, this situation here on the next slide is the only time you don't need to have Part B in place. So Medicare pays first. You must have Parts A and B unless when you turn 65, if you or your spouse are working for an employer of 20 or more employees, and you're covered by that employer's health insurance as an active employee, or the spouse of an active employee, working for an employer of 20 or more people. In that situation, the employer has to pay first, Medicare pays second. So if when you turn 65, you are working for an employer of 20 or more employees, you're covered by that employer's health insurance as an active employee, then while you're still working for that employer past 65, Medicare pays second, the employer's group insurance has to pay first. Medicare does not force you to pay for Part B as secondary coverage. In that situation, you can wait until you retire or quit working for that employer. At that point, you can get your Medicare Part B right away. There'll be no penalty. It works for your spouse too. Let's say that you're working for an employer of 20 more employees. You've got your health insurance as an active employee from that employer, and you have your spouse on that insurance, and your spouse turns 65. It's the same as your spouse working down there. Medicare would be secondary for your spouse until you retire. At that point, your spouse can get their Part B right away with no penalty. Now, if you do that, then you need to remember, if you don't take Part B for that very reason, and I'll talk a little bit why you probably shouldn't, but if you don't take Part B for that reason, because Medicare Secondary, then when you do retire, or if you're covered by your spouse's employment, when your spouse retires later, you get something called a special enrollment period, a chance to take your Part B right away. There won't be any penalty, you won't pay any extra. And as I said, it will start right away. But the timing is really important here. So let's say you are working past 65, didn't take Part B because you were covered by your employer of 20 more employees. So you didn't take Part B. And say you retire in a month, and this is October. Say you retired anytime in October. In that situation, you're working past 65, you retire in October. Medicare would then become your primary payer midnight November 1st. you need to have your Medicare Part B, A, and B in place. So if you work past 65 and you're covered by active employment from employers 20 more people, then Medicare becomes your primary payer the first second of the month after retirement. So say you were 68 right now, retired in October, Medicare becomes primary midnight November 1st for you. You got to have your Medicare A and B in place midnight November 1st. You'd actually have till the end of November, the month after retirement, to file for your Part B, have it retroactive back to November 1st, and not have a gap in coverage. And I always mention that because if you just go read the literature, it tells you have 8 months in that situation after retirement to file for Part B. But I don't want anybody to have 1 second's gap in coverage. That person who worked past 65, retired in October, and they've waited till December, the second month after retirement, to file for the Part B, it wouldn't start till January to have 2 whole months without any coverage for doctor bills. I'd be afraid to leave the house if I was in that situation. And so in my opinion, that special enrollment period is only 1 month long. Be sure and file for it at the very latest, the month after you retire, if you're working past 65 and Medicare is your secondary payer until retirement. Now, I'd encourage you to file for Medicare Part B in that situation 3 months before you retire. You can file for it up to 3 months ahead of time. If you know when you're going to retire, then 3 months ahead of that month, file for your Part B. That gives Social Security time to get your new Medicare card to you, showing you have Part B by the time Medicare becomes primary. But if you don't have 3 months warning, I did a personal consultation with somebody a few weeks ago that didn't know he was retired and went to work that morning. So if you don't have 3 months warning, then if you're working past 65 for Medicare Secondary, be sure and file for Part B at the very latest, the month after retirement. But remember, and I'll probably beat a dead horse, but it's so important, if you are working for an employer of less than 20 employees, or you're not covered by your employer's health insurance at 65, or you're retired, or you're self-employed, you've got to have A and B in place the month you turn 65 and file for that 3 months ahead of time. Now, let's go on with somebody who's in that situation. They're working past 65. Let's go to the next slide. So this is the situation. Somebody's working past 65 for an employer of 20 or more people, or they're the spouse of somebody working for an employer of 20 or more people. They're covered by the employer's active employees health insurance, so Medicare Secondary. Should they take Part A in Medicare Secondary, or should they want to take Part B? And this is where it kind of does get complicated. Let's take Part A first. Remember, for almost everybody, Part A doesn't cost them any extra premium because we pay for it while we're working. So if Medicare Secondary, because they're covered by active employment for this employer 20 more people, if they took Part A of Medicare, then they'd have secondary coverage on an inpatient hospital bill. So they very well might want to take Part B in that situation. But there's one situation where you might not want to. And that is if you have something called an HSA, which stands for Health Savings Account. Now, I'm not talking here about your flexible spending that you lose at the end of the year if you don't spend it. I'm not talking about that. This is your actual health insurance. To have an HSA or Health Savings Account, you have to have a high deductible health insurance policy. And then you get to put tax-free money in that HSA to use in the future if you have a whole lot of doctor bills to help pay those high deductibles. Well, the law says that you cannot put any more tax-free money in an HSA once you are entitled to any part of Medicare. So somebody's working past age 65 for them employ 20 more people, so Medicare Secondary. If they filed for Part A of Medicare, they could not put any more tax-free money in that HSA. So in that situation, if you're in that situation with Medicare Secondary, you might want to delay taking Part A until you retire. Let's go a little deeper in that situation. The Medicare law was written in 1965, and that was decades before the law was written that established HSAs. And when that happens, Congress doesn't always think the laws together perfectly, and they did not in this case. The original Medicare law that still applies states that if someone doesn't take Medicare Part A the month they turn 65, then when they file for either it or Social Security later, they will be entitled to Medicare Part A 6 months before the month they applied for those benefits. Part A will be retroactive 6 months or back to the month they turned 65, if that's less than 6 months in the past. So if you, in that situation, you're working past 65, so Medicare Secondary, because you're covered by active employment for an employer of 20 more people, you need to stop putting tax money in that HSA 6 months before the month you apply for either Social Security or Medicare Part A, because Part A will be retroactive 6 months. They can't stop that from happening because that is the law. And going along with that, the law also says if you're receiving a Social Security check and you're 65 or over, you automatically have Part A. You can't separate them. So if you start drawing your Social Security when you reach your full retirement age, because there's no limit on your earnings then remember you will have Medicare Part A automatically. You need to stop making those HSA contributions 6 months before the month you apply for those Social Security benefits in that situation. And let's go a little further than that. Now, Medicare Part D, D like dog, Medicare Part D covers prescriptions. And the Part D law says when someone turns 65, when somebody turns, it muted me almost automatically for some reason. You can hear me now, right? Okay, when somebody turns 65, if they don't have what is called creditable coverage for prescriptions, which means as good as Medicare Part D. So when somebody turns 65, if their coverage for prescriptions is not as good as Medicare Part D, then when they do retire later and get their Medicare Part D in place for prescriptions, they will pay a penalty. They will pay a higher premium for their Part D for not having that creditable coverage, as good a coverage. Well, to have a HSA in the first place, somebody has to have a high deductible health insurance policy. That is automatically not as good as Medicare Part D because Part D does not have that high deductible on prescriptions. So somebody stays in a high deductible health insurance policy after age 65, then when they do get Medicare Part D later, they will pay a higher premium for the rest of their life. Now it's 1% higher premium for Part D for each month. They didn't have that creditable coverage. It's not quite as bad as it sounds though, because it's 1% higher for each month. They didn't have that coverage of Part D's basic premium, which is about $35 a month this year. And I talked to a lot of people, particularly high income people. They put the pencil to it for themselves. And they say, I'm going to save a lot more in taxes in the next few years by staying in my HSA than I'll ever pay in higher Part D premiums. But you know, if you are in that situation, you might want to put the pencil to it for yourself to see. Now, I've only spoken to one person. This is very rare. I spoke to one person who had a high deductible policy with an HSA, but the prescription plan was separate from the health insurance plan and didn't have a high deductible. That coverage was creditable, but that's very, very rare. I've only run into one person like that. Normally, if you do have a high deductible policy with HSA, it won't be considered as good as Part D. That's Part A. If you don't have an HSA and you're working past 65 or Medicare Secondary, you might as well take Part A. It doesn't cost you anything. You'd have secondary coverage on the inpatient hospital bill. So if you don't have an HSA, you might as well take Part A. Let's take Part B. So once again, the situation is Medicare Secondary because you're covered at age 65 for health insurance by active employment for an employer of 20 or more employees. So Medicare Secondary. Should you take Part B? And the answer is probably not. And this is why. We all know that for most people, they no longer have health insurance from their employer into retirement and past 65 to pay secondary to Medicare. For most people these days, if they work past 65 and they retire, the employer insurance stops. They don't get to keep it past retirement. And so somebody working past 65 like this in this situation for Medicare Secondary, when they do retire, they're very likely going to want to buy something called a Medigap insurance policy, also called a Medicare supplement. It is a private insurance product that you buy to help pay what Medicare doesn't. Well, there's a protection built into the law on these Medigap policies. And that protection is, the law says, if you go to an insurance company and you tell them, I want to buy your Medigap policy, if at that place you've been entitled to Medicare Part B for less than 6 months, the insurance company not turn you down or charge you a penny more, no matter how sick you might be. But if you've been entitled to Part B for more than 6 months, they can turn you down or charge you whatever they want to. So let's take somebody who might be tempted to take Part B of Medicare when it's secondary. So the situation is, once again, this person is working for an employer of 20 or more employees. They're covered as an active employee by that employer's health insurance. But even though they're still an active employee, they've got a serious illness. They're still working, but they've got a serious illness, so having to go to the doctor all the time. And so the out-of-pocket costs of those doctor bills are adding up. So a lot of out-of-pocket costs their employer's insurance isn't paying. That person might be tempted to go ahead and take Part B, reasoning that Part B of Medicare might pay a lot of those out-of-pocket costs that employer's insurance is not. And Medicare Part B might pay a lot of those, yes. But this is the danger. Let's say that person retired 3 years later at age 68 after taking Part B at age 65. Well, they've been entitled to Part B more than 6 months, haven't they? They've had it in place for 3 years and they're already sick. They go to buy that Medigap policy at that point, they very well might be turned down or charged a whole lot of extra because they're already sick. The insurance company knows they're already sick. But that person waited to take Part B in that special enrollment period when they retired at age 68, they would have had Part B in place less than 6 months. No matter how sick they might be, how much it might cost that insurance company, they cannot be turned down or charged a penny more because they're in that first 6 months of being entitled to Medicare Part B. They've got that guaranteed issue right in the insurance language to buy that Part B, that Medigap policy with no extra cost. So that's why somebody probably shouldn't take Part B when it's secondary. They want to save that guaranteed right to buy that Medigap policy when they need it, which when they retire later and lose their employer's health insurance. Now, you do want secondary coverage to Medicare. Medicare pays about 80% of the hospital and doctor bills, like a lot of insurances do, like almost all of them did when Medicare started. But the issue is, as we get older and those total medical bills get higher, 20% that Medicare doesn't pay can be a whole lot of dollars. Remember, I said the record for me was Medicare for that one person's mother paid $2.1 million in hospital and doctor bills in 1 year for that one person. That's a lot of money. We're glad Medicare is there to do that. But that's more than that, that woman and her whole extended family, her children, her grandchildren, her cousins, all paid in total FICA taxes, all put together. But if 2.1 million was 80% of those bills, that means Medicare didn't pay about $400,000 in 1 year, which to me is still a whole lot of dollars. You want to be protected against that kind of catastrophic health event, which happens more often than you realize. There's 3 ways you can limit those out-of-pocket costs of Medicare. One, some people still have. If your employer offers you health insurance into retirement and past 65 to pay secondary to Medicare, check that out first. That very well might be your best deal. A lot of those employers that still offer that are still paying some of their own money into that, so bringing down your cost by doing that. But even if your employer is not putting their own money into that plan, they've still negotiated a group rate for you. So if your employer does offer retirees health insurance, you get to keep past 65 to pay secondary to Medicare, check that out first. Now, some employers say they like to offer that, but they charge so much nobody can afford to pay it. But most employers don't do that. But unless that's the situation, check that out first. But most people no longer have that option. Most people no longer have retirees health insurance from their employer. So if you don't have that option, then you have 2 other choices to limit your exposure to those out-of-pocket costs. You can stay with what they call original Medicare, which means there's no network. You stay at the original Medicare, then You can go to any doctor that accepts Medicare anytime you choose. Medicare pays first. You buy that Medigap policy from the insurance company to pay second. The other option is you can join something called a Medicare Advantage plan. It's the managed care part of Medicare. It's like an HMO. Now, some are PPOs, but they're set up mostly, like HMOs. So if you join a Medicare Advantage plan, then Medicare pays that plan a lot of money every month to give you your Medicare services. The way that limits your exposure to out-of-pocket cost is in that situation, you pay the same copay for hospital stays or doctor visits. Whether you have something very cheap and minor wrong with you or something major and expensive, you pay the same copay. But of course, it's managed care. You have to stay within their network. You have to go to their doctors, their hospitals. Now, at this point, if you didn't think it was complicated already, it gets even more complicated. So if you go back to original Medicare with no network, you're going to buy that Medigap policy. Well, there's a Medigap policy plan A, Medigap policy plan B, C, D, E, a bunch of them. If you go with Medicare Advantage, the managed care part, since you live in the fourth largest metro area in the country, every insurance company offers Medicare Advantage plans in the DFW area. Some offer more than one Medicare Advantage plan. And the best one for you may not be the best one for your spouse unless your diagnoses and medications are exactly the same. And then Medicare Part D for prescriptions. If you go back to original Medicare, you're buying that Medigap policy. You also then need to buy a Medicare Part D plan for your prescriptions. If you go with Medicare Advantage, most of them include Part D. That's part of you choosing which one offers you the best deals, which Part D plan of those Medicare Advantage plans covers your medications the best. That's part of your issues on choosing the best Medicare Advantage plan. But some Medicare Advantage plans don't cover prescriptions, so you might join a Medicare Advantage plan and still have to buy what they call a standalone Part D plan. There's about 30 Part D plans offered in Texas. The best one for you, more than likely, is not the best one for your spouse unless your medications are exactly the same. If we go to the next slide. Now, if you want to do this all yourself, I don't suggest it, but if you want to do this all yourself, then if you go to Medicare's website, which is medicare.gov, medicare.gov, there's something called a plan finder on there, but I don't suggest it. I suggest using the experts. Have you noticed there are no more jack of all trades in this world? This world is way too complicated. It's a world of experts now. Everybody's an expert in only one thing, their own job, because that's enough just to keep track of your own job anymore. You certainly can't keep track of somebody else's job at the same time. It's too complicated. That's why I rely on experts. That's why I'm speaking today. That's why you go to your financial planners there at the credit union. That's why you really go to the experts at the credit union for your questions. We'll use the experts here too. These are who the experts are. Medicare is not like Social Security. Medicare doesn't have Social Security, doesn't have offices all over the country like Social Security does. So Medicare does all the work through contractors. What they've done here is they've contracted with nonprofit organizations all around the country. They pay these nonprofit organizations to have people there who are experts in Medicare. So Medicare trains these people in all the Medicare rules and health insurance rules that apply. They're very well trained. I used to help train them when I worked at Social Security. They set them out there, these nonprofit agencies, pay these nonprofits to have them there, and they provide at no cost to us as the public help with picking our Medicare plans. So these experts can help you decide whether to go with original Medicare or with Medicare Advantage. Once you make that decision, which plans to choose and which Medicare Part D plans to choose, if you need to choose your Part D plan. They do a very good job. They are on salary. They don't have commissions. So their only job is to make sure they get you in the best plan for yourself. And these people are called the State Health Insurance Assistance Programs, State Health Insurance Assistance Programs. They quite often work for your local area agency on aging, but not always. but the best way to find them is just to pick up the phone and dial 211. We all know we dial 911 for emergencies. Everybody knows that, but people don't know about 211. 211 is not a Medicare number. It's a social insurance information number. If you have a question about a social insurance benefit and you need to know how to get in touch with the agency that provides that benefit, you just dial 211 and tell them what you need. They'll get you in touch with that agency. So when the time comes, if you just dial 211 and tell them, I want help with Medicare planning, they'll get you in touch with those Medicare trained professionals in your area. They'll help you, as I said, decide whether to go with original Medicare or Medicare Advantage, which plans to choose once you do that. If you need to, which standalone Medicare Part B plan to choose. And you can use them again and again. For example, if you go with original Medicare with no network, the Part D plan you buy is called a standalone Part D plan. If your prescriptions change during the year and your plan you have isn't covering your new prescription very well, then every autumn, we're in that time right now, every autumn there's an open season where you can change plans for the next year. It goes from October 15th through December 7th. We're almost in it this year. October 15th through December 7th each year, you can change those standalone Part D plans for the next year. Go back to these same people and help them find you a better plan for your new prescription. Also, if you're in a Medicare Advantage plan, you can change them every autumn in that same time period, October 15th through December 7th. So if you're in a Medicare Advantage plan and maybe your prescription's changed and their plan isn't covering as well as you think it might, go back to these people and see if should you change to another Medicare Advantage plan for the new year. So you can use them. There's no time limit how you can use them. You can use them every year if you need to. And then go to the next slide. The last thing is Social Security does the entitlement part of Medicare. So most things with Medicare, you're gonna contact Social Security. To enroll in Medicare A and B, you go contact Social Security. And so that is their website. You can file for Medicare online. You can file for almost all Social Security benefits online. For example, your own retirement benefits, for disability, for spouses, you can file for those Social Security benefits online. The only benefit you can't file for online are widows and widowers benefits. And that's because they have some options that Social Security needs to explain to somebody before they decide which one to file for. And so they need to contact Social Security and then call that toll-free number and apply over the phone. If you file for widows and widowers, all the benefits you can file for online. It is the best way. File online if you can, because there are a bunch of us baby boomers. Social Security is really, really busy these days. For example, if you're a baby boomer and you're getting ready to file for retirement benefits, the day you file, 14,000 other people file for that same benefit. 14,000 people a day file for retirement benefits. That doesn't count disability, spouses, widows, issuing 75,000 Social Security cards a day. So they're busy. So if it's not widows benefits, the best way is to file online. But if you don't want to file online, want to talk to somebody, call that toll-free number first, and they'll send appointments, when they're going to call you to take the application over the phone. And I want to thank Texas Trust for having me here. Thank you for your attention, and we'll open it up to see if we have any questions.
Thank you, Tom. You've provided us with a bunch of useful information, and we really appreciate it. Now I would encourage anyone who is currently watching this live to ask us or Mansfield Mission Center any questions they may have. Again, we will try to answer as many questions as we can today or get back with you individually after the webinar is over. If you have questions that will be best answered offline, we'll be sure to message you. I do see any questions. Sheila Khan did ask, what is the best way to get help when you have questions?
Well, if you have questions about the entitlement part of Medicare, when you need to file for different parts of Medicare, contact Social Security. If you have questions about picking your best Medicare plans, or if you have questions about whether to go with original or Medicare Advantage, then dial that 211 and tell me you want help with Medicare planning. That would be the best ones for that.
I heard you say there were specialists that specialize in answering the questions that work for nonprofits. Should anyone ever hire anyone to help them with getting answers about Medicare? Should they ever pay?
Well, possibly. I mean, I do personal consultations myself, but I don't do personal consultations to give people information they can get just as well, if not better, for free. Okay. So those people, I don't think there's anybody better. If you're trying to pick your best Medicare plan, I don't think there's anybody better than those people working for the nonprofit agencies that I've mentioned. And so I don't do those because that wouldn't be ethical to charge people for something they can get as well or better free. And the reason I say better is because, you know, I deal with the entitlement part of Medicare mostly in my consultations. I don't deal with that, but they do that all day, every day. And so that's what they do all day, every day, is help people find their best plans. They're on salary. They're already been paid by Medicare, basically, and they're local. And so if you use, for example, that plan finder, maybe the best plan on the computer comes up. On paper or on the computer looks like the best plan, but these people are local. They may know, well, that may look like the best plan, but they don't have a very good customer service department in this area. So really, we think the second best plan on there is really your best plan. They're local. They do it all every day. So they are the best people. I don't know why I don't think you should pay anybody to help you your best plans, because they're available and they've already been paid by Medicare.
Thank you, Tom. One more question. What if I am still working and Medicare age? What do I do?
Well, if you're still working for an employer of 20 or more people, that question may come in before we got to that in this deal, but if you're still working for an employer of 20 or more people and you're covered by your health insurance from that employer, then the employer pays first, Medicare pays second. Most times you should wait and take Part B at retirement. If you're working past 65, but remember to file for your Part B at retirement, say about 3 months before retirement. If you don't have a health savings account, go ahead and take Part A. If you have a health savings account, then probably don't take Part A either. And quit making those HSA contributions 6 months before the month you apply for those benefits.
Thank you. One last question, Tom. It says, I joined a little late, but what do you do? What info do you have on the new Medicare Act, where lawmakers are asking for the age requirement to be changed from 60 to 65?
I don't really have any information on that. Even when I work at Social Security, there are thousands of bills that are filed each year, but very few pass. And so I don't really worry about it until it becomes law. But the way I understand it, that like the Medicare for All thing or lowered Medicare's age, the way I understand most of those is that they wouldn't really affect Medicare funding for people 65 or over. Would be funded separately from the original Medicare program for people 65 and over. So it wouldn't really affect the people over 65. And once again, that would be something to contact your congressperson about, because it's not a law yet, and those bills get changed many times before they become law, if they ever do become law. So if you are interested in if you're interested in that passing or not passing, I don't know which side you might be on, but either way, that would be something to contact your congressperson about to get more information about what it really says before you make up the decision to be for or against it. I know, I'm guessing the person probably would be in favor of it, because if you're having to buy an individual insurance policy in your 60s, it is very, very expensive. And so, I mean, that's the reason why that law is in place. So if you're interested in it being passed, that would be something to talk to your congressperson about.
Thank you so much. Okay, seeing no other questions, if you would like to learn more or become a member or talk to us directly, please feel free to contact us using the information on the screen. We have some links posted in the comments for you if you would like to schedule an appointment or have one of us give you a call. You can request an appointment at texastrustcu.org/appointment, or you can reach a business community engagement representative at txtcu.wufoo.com. Next slide. So mark your calendars. Our next Facebook Live webinar will be on Tuesday, November 9th at 12 noon. We'll have our investment teams here to talk to you about investing your money. It will be well worth coming back for. So thank you so much for tuning in to today's webinar. And remember, Texas Trust Credit Union is here with you every step of the way for all of your financial needs. I'll see you next time.